Hi, my name is Dr. Troy Rohn, and I'm a professor at Boise State University. I'm running for the state legislature for District 19, Seat A, and I'm running for 3 reasons. Number 1, education. Being a professor and having 2 kids in public education, I'm very concerned about the direction of education in the state of Idaho. And there's been a lot of talk about the budget cuts and the Luna laws with regards to K through 12 education, but I would just like to spend a second talking about the effects that budget cuts have had on higher education where I work. Those budget cuts over the last 3 years have basically set back our university 10 years. We're currently at 2001 funding levels. And our universities in turn have had to pass these costs on to our students through higher tuition, which in turn forces them to work longer, to have more debt when they graduate, and to basically have a situation where they're paying off student loans for the next 10 years. Also, this is the first year since I've been at Boise State. I've been at Boise State for 12 years. This is the first year where we've had to turn away qualified students because of lack of resources. Already, Idaho colleges, we rank 47th in college enrollment rates, 44th in graduation rates. So this is not acceptable. We need educators in the legislature. And until we get educators in the legislature, nothing's going to change. And education is always going to be the first place that's cut. The second reason that I'm running is healthcare, and more specifically, Alzheimer's disease. I have a research program in Alzheimer's disease at Boise State. One of the things I would like to do is to develop a statewide strategic plan for this disease. Currently, there are enough Idahoans with Alzheimer's disease to fill Bronco Stadium, and that number is projected to double by 2025. Idaho is going to see some of the largest increases in Alzheimer's disease in the nation, namely because of our age demographics. What I would like to do is develop a statewide strategic plan to deal with this oncoming epidemic in Idaho. 27 other states have a state plan. Idaho does not. And one of the things I've been working on with my group is getting the green light to develop a statewide plan. So we have presented to the legislature this past session, and out of that came SCR 112, Senate Concurrent Resolution 112, which passed through the House and Senate without a single no vote. That basically gives us the green light to write a state plan. I would like to write that plan, present that bill, and pass that bill in my first term if elected. Also, healthcare. Healthcare, I believe, is going to be a major issue in the next session, and I believe we need a state-run insurance exchange system set up, and I would like to be a part of that. Finally, the third reason why I'm running is I'm a scientist, and I believe currently there's a general lack of science-driven policy in the legislature, and I would like to change that. I believe that there are many bills that come forth in which we could use sound, peer-reviewed science to drive policy. And so those are the 3 major reasons why I'm running. I hope I can have your vote. I'm a Democrat, and I look forward to having your vote on May 15th. Thank you.